morning, dear friends. Today we will see the ACL injury. What is ACL injury? ACL means anterior cruciate ligament. Ligaments are the fibrous tissue. These are fibrous bands which join two bones together. Anterior cruciate ligament is a ligament which is present in the knee. Along with the posterior cruciate ligament, it forms a cross within the knee joint. That is why it is also called cruciform ligament or cruciate ligament. The main purpose of anterior cruciate ligament is to prevent the anterior translation of tibia with respect to the femur. It provides stability to the knee joint. So, this ligament it can be injured in various activities, especially in those activities which put lot of stress on the knee joint. These activities are cutting. Cutting means when you are running and suddenly you change your direction. When you are running and suddenly you are changing your direction. Second, when your jump is awkward landing while jumping while jumping. It is also injured due to a direct blow on the knee. It is also injured when you suddenly stop while running. Sudden stop. All these factors are responsible for the knee injury. And whenever you injure your cruciate ligament, you often heard a loud pop or popping sensation is often felt within the knee joint. You are also having pain and swelling. You are also you also complain of giving way, or the instability of the knee joint. What does giving way means? Basically, giving way in in relation to knee joint means you are feeling that the postural support of knee joint is loss of postural support, or you can also call it as buckling buckling of the knee, or in layman terms bending. Mm. So, what are the candidates? Who are the ideal candidates for the conservative ACL rehab? This is not universal for everybody who is having ACL injury. There are few limitations within it, such as you cannot use this protocol for those who are too young. It is usually used for adults. Adults usually greater than 35 years is the consensus. You cannot use it in people who are having too active lifestyle. If there is no intra-articular injury confirmed radiologically, then you can go for the ACL conservative rehab. Mm. Now, the- this is uh, this is also for those who uh, who who are not able to frequently who are not able to frequently visit the um, clinic, rehab clinic. It will also be useful for those who are having financial constraints and cannot afford the payment of rehabilitation. Also um, for those people who are working very hard and to make their place within the sports, or who are working to and nail but are not able to perform because of the chronic lingering knee pain knee pain. It is also for those who want rehabilitation from the comfort of their home. Now, what actually is the ACL protocol? Basically, it is divided into four phases: phase one, phase two, phase three, and phase four. Phase one, 0 to 2 weeks, 0 to 2 weeks. Phase two, um, 3 to 5 weeks. Phase phase two, 3 to 5 weeks. Phase three, 6 to 8 weeks, and phase four, 8 to 12 weeks. So basically, the complete rehabilitation of conservative rehabilitation of ACL injury, it is completed within 12 weeks or 3 months. So let us discuss these phases one by one. Phase one is also known as immediate imme- immediate post-injury phase. Post-injury phase. It is also known as phase of motion and prevention. Because in this phase you mainly concentrate on the prevention of the um, effects of acute injury. In this phase, we are having the prevention of pain and swelling. For this, you can use rice rice principle, IFT, TENS, ultrasound, ultrasound therapy. This is not the diagnostic ultrasound, is used in physiotherapy. Mm, if you are not having access to the clinic, to any physiotherapy clinic, then instead of these modalities, you can use analgesics, simple analgesics for initial days, for few days, until your pain and swelling subsides. You can use Zerodol, Esclofenac, the drug present in this name, Esclofenac, or you can use Zerodol S. I am oversimplifying it now. Zerodol S. Ceratopeptidase is also present along with the aceclofenac. It will decrease pain as well as swelling. So this is only for those who can't afford to visit the clinic. Then, along with rice principle, they can use analgesics for initial few days until pain and swelling subsides. But there is the caution that analgesics. I request all those people who are having any trouble within the stomach, for example, any peptic ulcer, or who are having any problem with their kidneys, they please they do not don't use these analgesics. Instead, they should follow the clinic for initial period so that their pain and swelling gets subsided. What is this rice protocol? Rice basically is an acronym: rest, icing, compression, elevation. Rice, rest, icing, compression, and elevation. Now, strengthening. Strengthening. You have to strengthen your quadriceps, front of thigh muscles, hamstrings, back of thigh muscles, your adductors, medial thigh muscles, and your abductors, lateral thigh muscles, are includes gluteus, your gluteus maximus, gluteus medius, and your this tensor fascia lata. Also, you have to go for the stretching, stretching of uh, this tensor fascia lata, laterally present on the thigh, flexor flexor muscles of the hip, such as iliopsoas. You have to stretch quadriceps. You have to stretch hamstrings. Range of motion exercises, active and passive range of motion exercises you have to do, and you have to focus especially on the glide of patella, superior glide of patella. You have to go for the closed kinetic chain exercises. Now, for all those uh, who are not familiar with this terminology, I will tell them what are closed kinetic chain exercises. All those exercises in which the moving extremity, whether moving limb, whether upper or lower limb, in which the moving limb is in contact with the weight or ground and it is not able to move, you are not able to move the distal extremity. These exercises are known as closed kinetic chain exercises. For example, push ups. These are the closed kinetic chain exercises. But here you have to, I will tell you the closed kinetic chain exercise which you will follow. Initially, this is the your this squatting, but mini squats you have to do. Knee flexion should be less than 60 degree. Remember it. Also, you have to go for the proprioceptive exercises. Proprioceptive exercise, proprioception. What is proprioception? Proprioception is the awareness of your body parts without having look at them. Um, this is known as proprioception. Proprioceptive exercises which you will do at your home are the, I will tell you that tandem walking. What is tandem walking? Tandem walking is the walking within straight line, but in such a manner that the heel of your uh, one extremity, one foot, that the heel of your one foot touches the toes of your another foot. You will walk in such a manner that the heel touches the toes of another foot. Heel touches the toes. This is the tendon walking, but within the straight, but in the straight line. The second exercise you will do the balancing exercise. That's balancing exercise on Bosu ball. Bosu ball. Bosu ball is the common ball which is used in rehabilitation. It is easily available within the market. So you can also use crutches, auxiliary crutches, auxiliary crutches for initial walking. Now, when the stage comes when you are completely pain free, you can discard these scratches. You can throw away these scratches. So this is the phase one. Now I am going to erase it and I will discuss phase second. Phase second, 3 to 5, 3 to 5 weeks. This is known as phase of motion and control phase. So in this phase, you will continue exercises of phase first. Plus, in addition to this, number one, you will wear the hinged knee brace. You will wear the hinged knee brace. Hinged because it gives accurate flexion, accurate knee flexion, extension, control. Otherwise, you can use any brace, but I am stressing this one hinged brace because it gives better control. Second, now you remember one thing, you had started the closed kinetic chain exercises, mini squats in phase one. Now you have to progress closed kinetic chain exercises started in phase one. Now you are doing the mini squats. You have to progress to the uh, um, uh, theraband kicks, theraband kicks, leg presses, sit ups, wear hinged knee brace, progress closed kinetic chain exercises. Now this is the phase. This is the phase when you will start open kinetic chain exercises. Again, for those all those who don't know what the open kinetic chain exercise means, it is the exercise in which any exercise in which the distal part of the moving extremity or the moving limb remains free to move. This is the difference. In open kinetic chain exercises, you will do, you will, um, you will take one precaution, because open kinetic chain exercises. What is problem with the open kinetic chain exercises? Because it can cause excessive anterior translation of tibia. That is why you have to keep um, caution here. This is the open kinetic chain exercise. So number 4, you can use stationary bicycle. You can also use physiotherapy, bridging exercises on physiotherapy ball, bridging on physio ball, physio ball. You have to you have to strengthen the VMO, vastus medialis obliquus muscle. This is the muscle which is present within your knee. It is present in the knee within the quadriceps group of muscles. You know, quadriceps are four muscles. Quadriceps. These are four muscles. There is one muscle known as vastus um, intermedius. Vastus intermedius. The distal portion of vastus intermedius is known as uh, vastus intermedius is known as VMO, vastus medialis obliquus. You are having vastus lateralis, you are having vastus intermedius, vastus medialis. Vastus medialis, sorry, this actually the muscle is vastus medialis, and it is distal medial portion is known as vastus medialis obliquus. Why obliquus? Because its fibers are arranged transversely. Mm, Nearly they are transversely arranged, and they put the medial they pull the patella medially, and it becomes the prime medial stabilizer of the patella. And along with the vastus medialis lateralis, and vastus medialis obliquus, these muscles stabilize the patella within the trochlear groove. They stabilize the patella within the trochlear groove and prevent the mal-tracking of the patella within the groove, and thus they are contributing to the stability of the knee joint and prevent the abnormal mal-tracking of patella. You have to strengthen vastus medialis obliquus. Its exercise is very simple. You just sit on the chair, and you invert your foot and do extension of the knee. Sitting on the chair, everting your foot, everting your foot and do extension of the knee. It will strengthen the vastus medialis obliquus. It is also the terminal extensor of the knee and also the medial stabilizer of the knee. These are all exercises within the this um, phase second. For those people who are very lazy, they can easily use this stationary bicycle. They don't need to stress themselves. But you have also do these exercises, progressive kinetic chain exercises. You have to progress these exercises as well. Strengthening of this is also very important. Now phase third. Let us come to the phase third. Phase third. Um, 6 to 8 weeks duration. This is also known as um, um, strengthening strength and proprioception septive phase third. What is phase third? In phase third, number one, you should have less than 20% quadriceps deficit. Second, you continue exercises of phase second. Plus, number third, eccentric exercises. You have to start in this phase. Eccentric exercises of the knee joint quadriceps. Number 4, this is the phase when when uh, when you have to return to running means, according to biomechanics, running means sit-ups greater or equal to 170 sit-ups per minute. Simple. 170 steps per minute. And you should be completely pain free, minimal or no pain, minimal or no pain in this phase. Now phase 4 is the last phase and lasts from 8 to 12 weeks. Along with this phase where rehabilitation gets completed. It is also known as phase of unrestricted return to sports. Now in this phase you should have less than 10% of quadriceps deficit. Number 1. Number 2, HQ ratio should be normal. What is HQ ratio? HQ ratio basically this is the hamstring to over quadriceps ratio. Normally this is 60%. What does that mean? H H is to Q is equal to 60%. That means your hamstring your hamstrings are having 60% of the power of your quadriceps. I will make this more simple so that you can understand. Uh, let let us assume that your quadriceps is able to lift 100 kg of weight. You are doing regular exercise and you are lifting 100 kg of weight, your quadriceps. Now you are doing same exercise for hamstring. Your hamstring muscles should be able to lift 60 kg of weight. That is it. This is the normal ratio of quadriceps. And the athletes and the sports person, they are having more than 60% power of the this hamstrings, and it helps them to in the greater stability of the knee joint. Now this is the you also have to continue exercises of phase 3. Now last but not least, this is the phase when you can start plyometric exercises. What are plyometric exercises? Plyometric exercises. Plyometric exercises are all those exercises in which you are having rapid and repeated stretching, and contracting, of muscles, especially the thigh muscles. Example: jumping, lunging, popping. So we have completed the Four phases of anterior cruciate ligament conservative protocol. So anybody who is affected with this condition can follow this protocol from the comfort of their home. So this is all for today. Thank you.